I now call upon the flag bearer of AFPI, Dr. Raman Kumar, sir, to enlighten us on the topic, the past, present, and future of family medicine and primary care in India.
Thank you for giving me this opportunity to talk about past, present, and future of family medicine. And thank you all audience who are present here for holding on to the last. This is the last session. After that, we have valedictory session, and then we will disperse for this conference. So thank you very much. So I'll not go into the introduction. And I hold many affiliations. I've been doing many things. I'm also chair of the Specialist Board of Family Medicine. I do Institute of Family Medicine Primary Care. I've been in WONCA, which is World Organization of Family Doctors. And AFPI, as we all know, 9 principles of family medicine. There are these, I'm not going into details, but our logo represents 9 principles of family medicine. And this is well-documented literature. What are the 9 principles? That we are community-based, we provide continuity of care, comprehensive, all these things are mentioned in literature, so I'll not go into details. I try to be short so that we can complete our program in early. And through my international affiliations, we have Dr. Parmendra Prasad. I have represented all young doctors across the world on the WONCA World Board, 2013 to 15. And then I was South Asia President, 2018 to 21. So I have been traveling to different parts of the world, exposed to the health systems of the world. And our aspiration through AFPI has been to bring best practices in India. And in India also we have several good things in health system. Like we have capacity to service volumes that nobody else in the world can service. Like the number of patients that we see, number of surgeries that we do. I'll just give other examples of volume. People traveling in Delhi metro is 2.5 million, is equivalent to the population of Berlin. The people traveling every day in Indian railways is close or bigger than the population of Australia. So you can imagine the volume of service that we do in every domain of life, including healthcare. So number of patients seen in outpatient, number of patients treated, number of patients operated, and best thing, you can get treatment instant. It is unlike most of the developed country where you have to have long waiting days, months, even years to get many things sorted out, which is our strength, and we need to promote that, those practices in global area. We learn internationally, but we also have to give to the world. We are the pharmacy of the world, and we are the providers of human health resource to the world. This is important to acknowledge, but the areas where we are lagging, we need to improve. And primary care, family physicians care, or community-based clinical care services, which is not very well organized in India. If you compare to China, Brazil, where I visited, we are at least 10 years behind Brazil. These are similar countries. I would not compare to South Africa, BRICS, but China is much ahead. Brazil is also at least 10 years ahead. So when we talk of family medicine, we talking about whole person care. So normally people ask, ki, aapki specialization kya hai? What is the specialization? I say my specialization is taking care of the whole person, not one organ, gender, or age group. And family medicine is distinct in a way that it is whole person care. And when we think of a specialist and generalist, we need to understand that these two are different domains of healthcare, and you cannot compare both. And you see this graph, horizontal space, the area covered, and the vertical lines that you see are the specialist lines. And this cannot compare who knows better, who is better, who should. Both are required for 3-dimensional coverage of the pressing population healthcare needs. So when we talk of family physicians, family doctors, generalists, you see the horizontal plane. And we talk of the specialist care, which is of course required, and part of the system, it is the vertical lines that you see. And this is how any system works, be it bureaucracy, industry. Every system requires generalists, but we have total over-reliance or somewhat, predominance of specialist care, super specialist care, which is kind of making imbalances, bringing imbalances in our system, although we have huge capacity, but we are not able to serve the pressing population healthcare needs of the country. And I will not go into details of what is generalism, but this is something we need to notice, take notice of it as academicians and as professionals. And we often say jack of all, master of none, but generalism is a very high order thinking, and these are polymaths. When a specialist can be, master at doing things in a particular, skill or competency, but generalist is one who can become genius. So geniuses of all time, Leonardo da Vinci, if you see, was master in many skills. He was a painter, sculptor, musician, and he excelled in all domains of life. If you look in India, we have people like Rabindranath Tagore, who was poet, musician, sculptor, artist, Mahatma Gandhi, lawyer, politician, social reformer, thinker. These are all polymaths, and these are generalist people. Today we heard Swamiji, who spoke so well about primary care, family medicine. How did he know about it? Because he's a generalist. We heard our governor, who is a military background person, who is holding a political position, but he could easily understand what is a role of family physician, doctor, or what is this conference about, because he's a generalist. So generalist is very, very important. The history of family medicine, if you look from the 1947, Bhore Committee was formed in 1948. Medical Council of India kind of formalized the qualification of medical graduates, standardized it in form of MBBS. Earlier, there used to be licentiate examinations, which was 3-year course. Now they said that all Indian citizens will have 5-year course trained doctor. And about family medicine, Mehta Committee report said first time in 1983 that medical graduates need to be exposed to the clinics of general practitioners and family physicians. Then in National Policy 2002, and 17, again, this was re-emphasized. There is a paragraph in National Health Policy 2002 where they say that 25% of our medical graduates need to go into family medicine and public health, which is not being yet implemented, which is the main sore area why we formed this society and started advocating about it. And AFPI was founded in 2010, and we convened a meeting same year by Secretary Health, Government of India, and at the initiative of AFPI, and he wrote to all states in India that if any medical college in government sector wants to start Department of Family Medicine, the Government of India will give financial support for 5 years, to 2010. And because of that initiative and letter, Calicut Medical College started the first MD program in 2012. And we participated in several conferences. We had Spice Route founded, which is Young Doctors Movement for Family Physicians. In 2013, we had our first national conference at India International Center. This is where the policy impetus started taking place. You can see Mr. Kesu Desi Raju, Secretary Health, Government of India, then 2013. 10 years back, inaugurating our first conference, Professor Michael Kidd from Wonka, President-elect world, came to this conference. And you can see Professor K. Srinath Reddy, one of our senior members, Dr. Piyush Jain, Dr. Vandana Agrawal, all were part of this organizing team. And this is the beginning of FMC 2013, and now we come to 2024. This is 6th conference. Every 2 years we do conferences. And this was the first conference where we organized. You can see me a bit younger at that time. And we also participated in international. These are the young doctor representatives at that time in different parts of the world, all continents. So we have a global connection. We know what is happening in the world, and we want to elevate the experience of our population to the global level. I was also a young doctor representative for young doctors across the world, and this is a meeting in Turkey, and you can see young family doctors in different parts of the world participating in Young Doctors Movement of WONGA, World Organization of Family Doctors, and this was held in Istanbul, Turkey again. And this is all for the same meetings. And 14, we had WONCA South Asia Conference. 15, we had National Conference, and we organized the first PG update in family medicine. 17, we moved out of Delhi and organized conference in Kochi. And this is from WONCA South Asia. And then we have been trying to advocate to the highest level of, highest offices of Government of India. And we invited J.P. Nadda ji, who was then Health Minister of Government of India, and currently he has again become Health Minister of Government of India. And we have been trying to advocate to the highest level of governance, to the Prime Minister Office, Health Ministry, and this is how it is becoming more and more impactful. This is again with Nadda ji. and we have been trying to engage with social cause, and we launched this campaign called Run for Family Health in 2015 itself with a great athlete, Mr. Milkha Singh ji, and he launched our program. And yesterday, as you saw, Mr. Madan Lal came to our conference, and he again relaunched. Every year we pledge to make ourselves fitter, our families fitter, our society fitter. And this is, I've been also traveling in different parts of the world, and you can see me with Health Minister of Bhutan. So if you can imagine, many times people ask, ये family medicine कहाँ पे होता है? भूटान में भी होता है. भूटान में there is a Department of General Practice in Kesar Ghapo Medical University, and I am with Professor Adhikari, who is Professor of General Practice in Bhutan. So भूटान जैसे छोटे देश में होता है, नेपाल जैसे कंट्री में बहुत सालों से हो रहा है, श्रीलंका में there is already हो रहा है, इंडिया में अगर इस डोमेन में हम देखें तो it is we are lagging behind even these countries. So इंडिया में भी डेवलपमेंट हो रहा है because it is a huge country, policy is all complicated to take forward to reform, but it is happening. And this was meeting in China, Colombo, Nepal, Sri Lanka, and South Asian group of family physicians from different parts of Pakistan. You can see Dr. Parmendra Prasad, Dr. Kanu Bala from Bangladesh, and Dr. Sri Ranjan, who is the current South Asia president from all this. This is from Sri Lanka. This is our international conferences are there already. So this one is from Wonka 18, the International Conference of Family Medicine. And you can see the South Asian participants. So it is a well-happening thing already. If you want to go and learn, next conference is happening in Portugal, in their capital city. And it is in 2025, September, same month. And you can see me with Dr. Pratap Prasad, who is one of the founding fathers of general practice in Nepal. And this is again the South Asian group. So we have linkages with different parts of the world, and we are learning and sharing, engaging, and trying to bring best practices in India. This is something which is missing, and we want to bring the highest level of primary care in India. This is the vision for this conference, that we want to elevate the standards of clinical care in primary care. 18, we organized World Rural Health Conference, which was attended by the Vice President of India, Health Minister of India, Mr. Ashwani Chaubeji, Mr. Venkaiah Naidu was the Vice President, National Health Commission mission. So in that meeting, Niti Aayog was the partner for that meeting. So we have been trying to engage with the policy making process, and we put a PIL in Supreme Court also, but then we approached the Prime Minister office, and it came through the Prime Minister office that our concerns regarding family medicine and primary care will be addressed in the National Health Commission Act, which was duly done. And if you look at the National Health Commission Act, at 4 or 5 sections, it is law of Parliament that UG board and PG board has to implement family medicine. No other specialty has been mentioned as a mandate of National Medical Commission out of several 20s, 30s, 40 disciplines. So earlier it was policy, went to the Supreme Court said that this is policy prerogative of the government, we cannot pass an order. But now if National Medical Commission does not implement it, it is a breach of law. It is breach of constitutional mandate by the Parliament. It has to be implemented sooner or later. We reframed the entire curriculum of DNB family medicine. Earlier it looked like that family physicians are being to be trained in the broad, कि 6 महीने इनको गायनी भेज दो, 6 महीने मेडिसिन भेज दो, ये कुछ रोटेशनल इंटर्नशिप जैसा है, और इसमें अलग अलग डिसिप्लिन की चीज़ें होती है, ऑर्थोपेडिक्स होता है, साइकेट्री होता है. हमने ये सारी टर्मिनोलॉजीज हटा दी. हमने बोला दिस इज़ होल पर्सन केयर, लाइफ साइकिल केयर. हमने कहीं पे उसमें पीडियाट्रिक्स नहीं लिखा, चाइल्ड हेल्थ लिखा है, उसमें साइकेट्री नहीं लिखा है, मेंटल हेल्थ लिखा है. हम किसी स्पेशलिस्ट स्पेशलाइजेशन को ओवर फ्रिंज नहीं कर रहे हैं. वी आर नॉट ट्राइंग टू ओवरलैप. These are the community context is important, where it is being done, and what setting is important, because those experiences will never be learned at the tertiary care institute. आप 20 साल इंटर्नशिप कर लेंगे मेडिकल कॉलेज में, you cannot become a family physician, because family physician का जो longitudinal experience learning होता है in community में, which I do, I never learned. I'm a hardcore intensivist. मुझे लाइन डालना, CVP डालना, इंटूबेट करना सब आता है. फाइनली डिसाइडेड आई विल बी फैमिली फिजिशियन. बट जब मैंने प्रैक्टिस स्टार्ट किया, देन आई लर्न कि ये क्या होता है. और वो तो लर्निंग कभी हो ही नहीं सकती हॉस्पिटल सेटिंग में। आप किसी से भी सीख ले, 20-20 साल इंटर्नशिप कर लेंगे, कभी नहीं आएगा। तो ये हमारी कोर कमेटी थी जिसमें NHSRC, गवर्नमेंट को सब लोगों ने बताया कि इसका करिकुलम कैसे होना चाहिए। वी डेवलप दैट करिकुलम एंड फर्स्ट टाइम we had a specialist board in family medicine which is represented by family physicians. Otherwise National Medical Commission में there is no family physician. किसी भी मेडिकल कॉलेज में कोई प्रोफेसर ही नहीं है. How can you expect anyone who is having no knowledge about family physicians? We are the one who are not represented in the medical college or National Medical Commission, even the UG board or PG board. So there is no knowledge base. Even senior persons, they may be very knowledgeable within their own discipline, but it is difficult for them because they are not exposed to this discipline. So we are trying to change that. This is deliberations about the curriculum at National Board of Examination. This is again our previous conferences. And Indian Medical Association has supported this in writing, written to the National Medical Commission as per the mandate. You can see me with Professor Jayalal, Indian Medical Association, and Dr. The Secretary. This is our National Executive. These are the different state chapters. This is the journey. 2021, we had the new curriculum. 2022, the IPHS guidelines, where we never had any position in the public health system for family medicine. In public health guidelines of 2022, this has been mandated district hospital, community health centers, and this is coming down to the primary health centers in due course of time. It is only because of the availability. UP government is the first government to recruit family medicine as a specialist for community health centers and district hospitals. This has already happened. And second or third batch of doctors have been, every year we celebrate Foundation Day. Yesterday we had national consultation on undergraduate family medicine last year. These are some photographs. The Director General of Health Services, CGHS, and Health Secretary, Additional Health Secretary. You can see Director AIIMS Gorakhpur. All these people have been progressing. Foundation Day, yesterday we observed, this was the first Foundation Day, India International Center. So, in nutshell, we are talking about rise of generalist. And this terminology is very, very important because our mind is tuned for basic, specialist, super specialist. But the importance of generalists, I have just talked, and every system requires generalists and specialists both, because otherwise system cannot work. And in the current context of Pradhan Mantri Jan Arogya Yojana, if we do not have gatekeeping, high quality primary care or clinical care in the community level, primary health center, community health center, we will continue to have overload of patients, and जो मारपीट होती है, violence at the hospitals, dissatisfaction at the private hospital, that will continue. So this is our effort, past, present, and future. And as I have registered my clinic in UP government, when I was registering, I had to create my digital ID as a physician. I had to create digital ID for my clinic. And everything is going to come on the digital platform of Government of India. Today, Ayushman Bharat does not cover the outpatient care, but it is going to cover. When I was enlisting what services I am going to provide in the digital mission of India, there was an option for family medicine. So this is the future of family medicine where we are going. We are having to have a uniform digital platform through Ayushman digital mission. And everybody will have a digital medical record provided by the Government of India. This is going to be true. And in that era, without a family physician's referral treatment, it will not be possible for anyone to go directly for common problems, small problems, to AIIMS or bigger hospitals. Thank you very much. Thank you very much.